1 in 8 women will get breast cancer in their lifetime, making breast cancer the second leading cause of cancer death within women. Doctors recommend patients to consider lumpectomies or mastectomies because it is highly effective, especially for early stages. It will reduce the amount of radiation therapy needed and has a low chance of reoccurrence. Yet many women are hesitant to these options because they fear of losing a part of their womanhood, fearing that their breasts will never look the same again. However, this is far from the truth. With recent technologies and medical advancements, breast restoration is made possible and will allow women to resume their life normally. The goal of breast reconstruction is to restore breasts to a normal shape, involving the appearance and symmetry following a lumpectomy or mastectomy. The first step to the process is to get a consultation, where your physician will discuss the surgical goals, your medical history, and all of the different options offered. There are a variety of techniques used for breast reconstruction. However, there are two main categories. You have the option of using implants or using your own tissue. For implant reconstruction, you would first get the mastectomy or lumpectomy surgery, where the surgeon will insert a tissue expander if needed. The tissue expander is a temporary device to create a pocket for the implant. Once expanded, the implant will be placed under the pectoral muscle as shown. After the surgery is completed, patients are to stay 1 to 2 days in the hospital and expect a recovery time of 4 to 6 weeks. After the implant exchange is done, it will take another 2 weeks of recovery. For a direct-to-implant procedure, where a tissue expander is not necessary, the patient is to expect a 4 to 6 week recovery. Furthermore, there are multiple implant decisions to be made, such as the content it is made out of, shape, and texture. These decisions will all be based on personal preference, and the surgeon will help achieve the patient's end goal. Silicone implants are filled with an elastic gel that feels and moves much like natural breast tissue, whereas saline implants are filled with sterile salt water that can be filled with various amounts of saline, which will affect the shape, firmness, and feel of the breast. Another decision to be made is the shape the patient wants to achieve. Round-shaped implants give the reconstructed breast a fuller and more projected chest, whereas teardrop-shaped implants mimic the natural shape of breasts, where they are heavier at the bottom and tapered at the top. Lastly, the texture of the implant. Textured implants allow the scar tissues to stick to the implant, making them less likely to move around inside and get repositioned. The smooth implant, on the other hand, allows the implant to move around freely, giving it a more natural movement. The patients pictured show before and after pictures of their breast reconstruction. Both women chose to get a breast augmentation following their reconstruction, and both used tissue expanders. The process for using your own tissue, otherwise known as a flap, has a few more options. The possible donor sites that the surgeon can get the flap from are the abdomen, back, buttock, and thigh. After this reconstruction procedure, the patient should expect to stay in the hospital for 1 to 2 days and a recovery period lasting from several weeks to several months. The first patient pictured chose her donor site to be from her abdomen, whereas the second patient pictured used her back for the flap. During this process, the portion of the donor site is dissected and transplanted to the chest, where it is reattached using microsurgery. Ultimately, healing is going to take several weeks for any type of reconstruction. It will take a while for swelling to decrease and for the shape of the breast to position and improve. Patients should expect scarring and realize that it will minimize with time. It is important to continue carefully monitoring the breast to ensure long-term health. Follow the surgeon's instructions and attend follow-ups as scheduled to maximize the reconstruction of the breasts. Although there are some obstacles, most women feel that these are small compared to the large improvement in their quality of life. Breast reconstruction has allowed breast cancer patients who have gone through so much start their life over and feel whole once again.